Hello everyone, I am Dr. Sangeeta Dubey, Resident Medical Officer at RGK Medical College, Kolkata. Today I am here to share the most common complaint present at our gynec OPD is polycystic ovarian syndrome. Polycystic ovarian syndrome. What is it? It is mainly characterized by menstrual irregularities, that is absent of menstruation, that is increased cycle length. Along with it, patient may present with heavy menstrual bleeding or prolonged bleeding. Infertility is also the main symptoms that patient may present. That is, the PCOS is the most common cause of female infertility. Along with it, obesity, that is excessive weight gain. This is also the main presentation in PCOD patient. In some cases, we can see the patient is having the normal weight or decrease their weight, but other features of PCOS are present. What are the other features? That is the features of hyperandrogenism. In these cases, the male hormone testosterone is increased that may produces increased facial hair growth along with hair fall, pimple or acne. And it is also characterized by insulin resistance. Features of insulin resistance, that is the black dark spot present behind the neck. Then how it is diagnosed? It is diagnosed mainly clinically, that is done by patients having the menstrual irregularities, and the clinical diagnosis, that is patients having the facial hair growth, acne, acanthosis nigricans. These are also, and ultrasound of lower abdomen also helps to diagnosis, that is the patient having the tiny cyst in both the ovaries. Then what is cause of this polycystic ovarian syndrome? Exact cause is not known. That is, two factors are hypothesized. One is genetic and another is lifestyle. So what is the treatment? The treatment is, that is main treatment is that is depending upon the what is patient required. If patient is present with menstrual irregularities, we can treat with them the oral contraceptive pill. If the patient is present with infertility, we treat them by ovulation inducing agent. As because in polycystic ovarian syndrome, the ovaries, the ovum or egg is not matured or released, and they are trapped to form the teeny follicle, and so they require the ovulation inducing agent. Main mode of treatment is regular diet and exercise. Exercise or yoga is should do, or it is the main mode of treatment to decrease the weight. By decreasing weight, by doing exercise or yoga and diet restriction, they can normalize their menstrual cycle or improve their fertility rate. And diet restriction is the one mode of the treatment, as because they have to cut off their calorie intake by cut off their carbohydrate intake, the fatty food or junk food. Then one of the factors, that is that patient may sometimes present with psychological symptoms like the patient will present with anxiety, depression, or low self-esteem because of the obesity or the facial hair growth. So we treat them by doing regular yoga or exercise, by diet restriction, and also the cosmetic treatment. Now, in this COVID-19 pandemic situation, most of the women, they are working from home. Many of the women, they lost their job, and so many of them suffering from depression, anxiety. As because of this, they are increase their weight or put on their weight. So what to do? They should restrict their diet and regular do the exercise. They do exercise at home. There is no need to go out or doing gym. They can do at their home, and by maintaining their weight, they can normalize or regularize their menstrual cycle. I think this small video will surely help you how to manage polycystic ovarian syndrome by themselves. Thank you.